hello again. I'd like now to introduce the next panel on behalf of Deepak and myself. Over to you, Deepak. I'll share. So good morning again. So we now move to the panel on recommendations from the DHS and IHD roundtables. And some context before we start the discussions. So across Europe, there have been a growing number of data infrastructure and ecosystems being developed, focusing primarily on e-health and research. Some of these initiatives have been complementary. Sometimes they've involved different approaches, and they provide an opportunity to learn and share. The need for EU-wide alignment to give confidence to citizens and trust to data providers and data users, and avoid divergence, whether that's for processes or security, is critical. For valuable European levers for alignment are GDPR, the European e-health electronic format, the pandemic, which provides opportunities in relation to analytics and the use of data, and then the important research competitiveness of the European Union as against the US and China. This leads to opportunities for the alignment of the European health data space, an opportunity to inform the design and governance of EHDS, and an opportunity to use that as a catalyst for consistency and shared learning, not divergence. So the origins of the calls to action that we're about to talk are the two roundtables that I referred to earlier on the acceptance criteria for societal trust in the use of health data, a recipe for trustworthy digital health on standards, architecture, and value. And these were developed and run by DHS and IHD in a neutral and independent way. The roundtables were sponsored by Johnson & Johnson and Microsoft, and each involved 27 invited participants from industry, academia, health systems, health professionals, and patient representatives. Today, we present the main proposed drafts calls, and they are draft, and they are for your input and feedback. And at the end, we're giving our email addresses in order for you to send us any written comments you may wish to make. So the main themes for the calls to action are digital health and data literacy for patients, citizens, and professionals, generating trustworthy real-world evidence, accelerating the interoperability across Europe, benefits to society from data access, use, and reuse, adopting a risk stratification approach to data reuse, regulation and transparency of data access and use, and finally, a transformational approach to health data. And with that, I'll hand over to Deepak.
Leighton, thank you very much. Good morning, everyone. My name is Deepak Kalra, and I'm the president of the European Institute for Innovation through Health Data, IHD. It's been a real pleasure, Leighton, to work with you over the last few months to prepare for these roundtables, to run them, and to have engaged with some fantastic stakeholders from different parts of Europe. Today, we have a panel to help us discuss these calls to action. And I'd like to just allow each of the panelists to say a few words of personal welcome and introduction. And also we have a slightly special situation where we have three panelists who are going to be discussing the recommendations, who I'll introduce in a second. But we also have Joanna from the European Commission, who is playing a spearheading role on the European health data space. and she will give some more closing reflections on what she's heard from the three panelists. So I'm going to go to all four of them and ask you just for maybe 15 seconds, if you don't mind being tight for time, and just say a welcome and introduce yourselves. So can I go to Nicola first?
Good morning, Deepak. Good morning, Bled, and apologies for being slightly late. I was on another call, so I had to jump a little, as many of us do these days. I'm here representing the European Patients Forum as a special advisor, and I'm also the chair of Data Saves Lives, which is highly pertinent, I think, to this initiative. And I'd just like to congratulate you on the roundtables, and obviously the fruits of this is very evident in what we're discussing today. So delighted to be here. Thank you very much.
Nicola, thank you very much. Nigel, could I come to you and ask you to introduce yourself as well?
Get myself off mute. Yes, good morning, everyone. Thank you very much for the opportunity to participate. It's an excellent initiative. I think very timely, as we've heard, especially in terms of this pandemic and the data not being in the right place at the right time to answer the right questions. I'm a scientific director based in the epidemiology group within Janssen R&D, and also project lead, so co-coordinating with Associate Professor Peter Reinbeck, European Health Data and Evidence Network EDEN, which is an IMI2 project, probably the largest of its kind, related to observational data in Europe. Thank you, Deepak.
Wonderful, thank you, Nigel. Jesper, could I turn to you next, please?
Of course. Jesper Kjær, the director of the Data Analytical Center here at the Danish Medicine Agency. And we officially opened yesterday. So just in case if you're curious, you can go to our website and see the live stream and the speeches from the newly appointed executive director of EMA and others. So just for a little bit of information, if you're curious.
Well, congratulations on that, Jesper.
Thank you.
That's wonderful. Joanna, thank you very much for joining us today. Can I ask you to also introduce yourself? Sorry, I was seeing her name on my participant list, but perhaps she's in and out of the call.
Yes,
Okay.
sorry, I had some problems with the video and with the audio. So my name is Joanna Gligor. I'm a head of unit for European Reference Networks and Digital Health in DG Santé.
That's great. And thank you very much for joining us today on this panel session and for agreeing to kind of listen for a while, hear the three panelists debate the topics, and then give us your summing up reflections a little bit later. So thanks very much for that. So Ledin, if it's okay with you, I'd like to ask if you could now take us to the first of the topics and just show that on screen. It'll be on screen for a few moments while I briefly summarize it, and then we'll be removing the slide, and instead you will see the photographs of our panelists. So Ledin, can I ask if you could show that first slide? And of course, if you are showing it and I'm not seeing it, then just tell me.
Okay, I'll share my screen because it doesn't look as though the...
No, that's great. That's fine. If we're not seeing it in presentation mode, don't worry. Oh, that's perfect. Thank you very much. So panelists, you know this already, but for the audience to say that we had these two roundtables, and it was fascinating to hear that the topic of digital and data literacy arose in both of them. So whether you're thinking about societal acceptability or interoperability or big data, this topic comes up. And it was clear that although there are some generalized movements going on, there is a need now for us to take a much more proactive and determined stance on this topic. I was pleased to find that both our roundtables highlighted the importance of the public, whether they're patients or healthy citizens, and you can see some bullets relating to the kind of skills that we'd like them to be able to be strong in, but also health professionals who touch the data, but also who work with patients, that they also need to strengthen their data and digital literacy. And we close this slide with a couple of strong emphasized points that are kinds of call to action. And I'd like to ask the three panelists really to say why you've thought, all three of you thought, this was a really important priority area for us, why you think it's important, and what you think are the actions that really are needed to turn it into reality, and who are the prime movers, in your opinion. Nicola, could I turn to you first?
Sure. Yes, I mean, I was actually one of the panelists who identified this as possibly the most important call for action alongside interoperability. Obviously, it is the cornerstone enabling not only technical understanding, but also broader societal buy-in. And it goes clearly with some of the other calls for action in the context of transparency. From our perspective, the ideal health data space will be a space where patients will be in control of what happens to their data through informed decision making, can follow what happens to their data in a transparent way, and can make sure that their data sharing leads to clear benefits for them, for their peers, for future generations, and for wider society. For that to happen, there needs to be a clear push towards literacy, not only for public, but for patients with chronic diseases for whom data is particularly important. So that piece looking at literacy for patients and the public is really key. The other element that I really liked in this slide is the commitment to resources, not just financial resources, but also human resources, because this thrust towards literacy for patients and healthcare professionals won't happen overnight on its own with no investment. It requires thinking, it requires investment. And I was also really pleased to see the inclusivity, to think about how to promote literacy across the life cycle with different ethnicities, backgrounds, other population subgroups, really leaving no one behind in the spirit of the Sustainable Development Goals. So those would be my initial comments, I think, in relation to that first call for action. Thank you.
Nicola, that's great. Thank you very much indeed. So, Nigel, I will vary the order of the panelists, but this time round I'll stick with the previous order. So, Nigel, would you be willing for a couple of minutes to say what it hits you about this slide?
No, thank you very much. Of course, I agree with everything you just commented on, Nicola, and I'm sure we'll all probably agree on all of our comments, which will be positive about digital data and health literacy. I take a step back. I think there's actually a challenge here at a societal level. Our society has been rapidly digitalized in many aspects of our lives, not just healthcare actually. And in fact, there's a need to enhance education from primary basic education right through to university level and beyond, and specialist education, of course, within healthcare. And this is to keep pace with many emerging and accelerating trends within healthcare alone, let alone in society. So everything from digital through to omics to all sorts of aspects. So I think we have an education deficit to meet current expectations and certainly future expectations that needs to be addressed. And as such, without addressing that, having a broader debate about this, we are really challenged in trying to legitimately, I think, converse about the use of data within society. People don't quite understand what we're really all talking about. And I think this is a really principal issue. It needs to be balanced as well. I think when you talk about not just the risks, which are clearly understandable, but also the benefits. And that's always usually a gap, I think, in terms of addressing all these kind of issues. And Nicola and Data Saves Lives are, of course, a good example of trying to address this too as well. But certainly, I think this needs to happen early, young, right through to continuing to older education as well. And certainly, as we've learned, again, of course, focused by the rather black lens of COVID-19. Right through to policy level. You know, I think, unfortunately, right through to political and policy level and downwards, there's again a education gap. There's a lot of rhetoric and hype. You know, everyone talks about AI as this wonderful panacea and bullet to save everything. But what do we actually mean by artificial intelligence? Is actually quite a misnomer term. But it is an awful lot of hype that needs to be dispelled and mythology around data. and digital too. So I think, at all levels, we have a lot to do. There needs to be a lot of resources added to this. Thank you.
Nigel, thanks very much. Jesper, what's your take on this?
Well, I think where I came from was that we come from a past where healthcare data was generated by healthcare professionals in order to exercise their profession, which is still true and very important for the healthcare data that we will talk about later becoming interoperable. Now, reality is that on my phone, I start to generate other healthcare data, and I have a number of other data sources that may be attached to me. I may not even be aware that that could be considered healthcare data, whether it's my grocery shopping, whether it's the history of people around me smoking, or what kind of exposures I get these days as my app is telling me whether I've been close to someone who has COVID-19. There's a number of apps and devices out there that start to generate healthcare information. I should be able to better understand that. I should be able to understand what it means on a diastolic, systolic, blood pressure, on a BMI, etc. That may actually not be the case with most of the citizens in Europe. We need to make sure that people understand those basic concepts so they can actually weigh in on decisions of how that data is being used as they start to generate it themselves, as they start to download apps and use websites where that comes into play. Is really democratizing healthcare data. And it's something where the literacy needs to be there in the population and go and see the doctor whenever that is critically needed or just needed, so to say. So people don't start to self-treat overly and actually know when to go and see a doctor and not think they can do it themselves. So
that's great. Thank you very much. I just would like to remind the audience that if you had wanted to put a question to the panelists, please use the chat. And I will do my best to synthesize from a potential flood of questions a small number of bites that I can throw at our panelists. But in the absence of that, at this minute, none that I can see, I'm instead going to ask the panelists to just give a quick fire response to one question from me, which is one of the bullets on the slide, the one that emphasized the importance of setting an annual budget and funding resources, suggested that the target actor is the healthcare funder. And the reason for that is because they seem to have most of the money when it comes to healthcare, and therefore it may be their budgets that could also allocate resources to literacy. Do you think that's the right stakeholder to push the button, or do you think there's another one that should be more forceful?
Can I say also
funding? Something? Oh yes, Joanna, please do. I apologize. Yes, you're welcome to.
Thank you very much. I apologize, but I don't know. I don't have access on my computer, so I'm using my iPhone, and I'm a little bit. I don't manage to send comments in chat. So I just wanted basically to remind a very important element, which is the next framework has found digital transformation of health and care and for digital literacy under the European Social Fund and under the Recovery and Resilience Funds. These are very, very, very important sources that I cannot underline enough, but which are very much overlooked. My personal impression is that our health interlocutors and digital health interlocutors at national and at national level, be it at government level and also civil society, are not always aware about the use of these sources. And I think it is very important to have several elements to make sure that we have funding requested by the member states under the operational programs or under the recovery and resilience facility plans for these areas, and also that we make sure that the training courses are done in a way which is meaningful. So there, I think there is a huge role for the universities, for stakeholders to design basically the let's say the core curricula, and then to bring this forward. This is for those who have already graduated and for patients in general. For the healthcare providers which are already in school, let's say university or in the another form of studying, I think there we also have the means of Regulated Professions Directive, and we are working quite closely with the colleagues in DG GROW in order to see how the digital health could be part of the core curricula. And we had last year, I think, the time is a little bit blurred now with confinement and everything. We had a discussion with the deans of medicine's universities, which have showed a lot of commitment in putting forward the curricula for the student doctors and the nurses which are still in studies on the digital health. And I think it is very important to streamline these elements within the core curricula for the future healthcare professionals. But we should also try to use European Social Fund Plus and the RRF in order to upgrade the skills of those who have already graduated in terms of healthcare professionals or the patients. And here there is a huge role of the stakeholders of the whole society in order to put this on the table and to design the courses adequately.
Wonderful. Thank you so much for providing us that European perspective and reminding us of the funding, but also the importance perhaps of working collaboratively across countries and not within countries only on addressing this. I appreciate there's a chat question. I'm just going to take this one. I'm going to withdraw my previous question, but just allow Jesper, if you could just take a few seconds to say what you meant by the phrase democratize healthcare data. And then I'll ask Bledin maybe in parallel to take the slides and show us the next slide. But Jesper, would you mind just saying what you meant by that phrase?
Sure, absolutely. But I think that is effectively what is happening as you start to generate healthcare data yourself, right? So it suddenly becomes something I generate about myself rather than the healthcare system generating about me. And I think that's a fundamental difference in what happens, right? Because that suddenly leaves me at the full control of my own healthcare data, which may not be the case. Yet, however, it also leaves me in a bit of a void where there's no professional support for what I do. And maybe we may be left to the devices, the apps, the AI in that, and how can I even trust that? So there's some complications around that I think we need to further understand. But in order to ensure that citizens in Europe better understand those risks and what it means to them, they need to be trained in understanding healthcare data so they can actually adequately work with democratized healthcare data.
Great, Jesper, thank you very much. Now, I know that we could spend the whole of this hour on this one topic, but I will move us on to the next one because it takes us to a different spectrum of users and uses. So the second topic is about generating trustworthy real-world evidence. So Bledin, I presume that you will show that slide as soon as you can. I confess I'm not seeing it. It's nice to see Jesper's face, but
it's on screen.
The audience at least should see the slide. But in summary, I'll just kick off the remarks, the summarizing remarks. So this is really at the other end of the spectrum, assuming that we have a data ecosystem, we have well-literate patients and professionals, and the data is flowing around the place. How do we help ensure that this does lead to trustworthy real-world evidence, and the people who actually are going to use it as evidence know when they can trust the data and make good use of data resources by asking the right questions so they learn the right things? So Jesper, turning back to you as a regulatory spokesperson, can you please tell us what you think about how we can ensure trustworthy evidence?
Well, to me, it all comes down to transparency. It comes down to lineage, and it comes down to traceability. So you can always go back and find the source without really compromising the need to ensure that you get GDPR compliant use of that data. But we've had, unfortunately, over the summer this year, a very concrete example in Lancet with hydroxychloroquine, where obviously a really large real-world data study revealed some understanding about the side effects of hydroxychloroquine, yet it turned out not to be trustworthy data, although all the settings around it would lead us to believe it should be trustworthy. So it's just highlighting that we need to develop the right technologies in this space to allow us to trace back to the source and then truly understand the mechanisms that were in place to generate, collect, and gather that data. So we can understand the underlying potential mechanisms of bias, whether that's unconscious or just happens to be there out of the natural selection that is happening on that data, but also to detect fraud if that's the case. So to me, that's trustworthiness, the ability to trace it back and understand where it came from, how it's gathered, and how it's been analyzed. So.
Jesper, thanks very much. Nigel, if I could turn to you, you are running Europe's largest superhighway for generating evidence, and the word evidence E is in the name of the project you run. What's your reaction to this, this second voted topic arising from our roundtables about how we can ensure there's trust when people use the data and that they use it in sensible ways?
Thank you. No, I appreciate that, Deepak, and I concur with the comments just now from Jesper as well. I think in terms of auditable process, if you like, to evaluate the utilization of such data, I think actually it starts earlier. And actually it also linked to digital data and health literacy as well before it. We need a lot more work on actually creating the question. Actually, there's a hell of a lot more work that emphasis, suggested. I think it was Einstein that said if he had an hour to answer a question, he'd spend 15 minutes on the question and 10 minutes on the answer. I don't know many people brave enough to do that, but actually, understanding what it is we're trying to ask and what we can ask is really, really critically important. Because of course, ultimately, quite often you hear a lot about dissatisfaction of using real world data and lots of challenges with it and so on. And quite often that's not necessarily intrinsic to the data, but it's also actually intrinsic to the question being asked and whether it's even realistic of real world or observational data. So again, also, I think we have to be quite honest and realistic about the benefits and attributes of such data, but also recognizing that it's a mess. It's very challenging to work with. Needs a lot of curation. It's one of the reasons Eden exists, of course, and other programs and projects as well. And importantly, that we can understand the answer in context. Actually, that's critically important as well. There's a lot, I think, in terms of tools and methods that we need to understand better in terms of using real world data. That's distinct, if you like, from other data like randomized clinical trials and so forth as well. So importantly, I think context is extremely critical too. I agree with Jesper, as I say earlier, about the audit trail, of course, as well, and in certainly understanding, what's the difference between causation and correlation as well. This has been a big issue, I think, across a lot of science. I mean, unfortunately, not just the hydroxychloroquine studies, but there's been a lot of ropey science this year related to COVID-19, and it's quite remarkable actually how much of it's even been published. So there are intrinsic challenges also in our peer review system, and also ensuring experts who understand this area truly can review also what is being studied, what is being published, and so forth appropriately. And there's, shall we say diplomatically, there's a key difference in some of the quality, and that needs to be better understood too. And that goes forward in journals, but of course, as Jesper, I think, was alluding to, regulators, but also for us in industry, academia, with NGOs and patient organizations and everything. It comes back to education and the ability to critique, having the literacy to do so. I'll stop there. Thank you.
Nigel, thanks very much. And of course, that is why the previous slide was the first ranked, because literacy in the end, the ability for everybody to be engaged in the data environment meaningfully and sensibly is the priority that helps enable. Nicola, I'd like your view on this. I mean, there is a risk of assuming that the only people who care about evidence are the serious, professional decision makers, regulators, health ministries, public health officials, and maybe you would back that. But I'd like you to feel a bit more flexible about who you think cares about real world evidence and its trust.
I think increasingly patients, as they generate their own data, etc., and a part of the conversation, also see the importance of real world data, real world evidence. And I think it's really important to highlight the difference there, because it's a journey from real world data to real world evidence, of course, as everybody on this call knows. I would fully support colleagues on the panel with regard to posing the right questions, the importance of context, of course, the audit trail, etc. All of that is really clear to me. Having a number of healthcare professionals in my family who are really on the front line, not just in the context of COVID, but in the context of lifelong devotion to their specific professions. I think all of this needs to be set in the context of massive change management. And I think healthcare professionals in a highly pressurized environment, and we only need to look to COVID to see this, to experience this, to sense this, they need to know and understand fundamentally why it is worth their investment of time to actually be part of the real world data, real world evidence story, and how that is actually going to benefit their patients and ultimately broader society. So I think that bullet point on a motivating culture within healthcare professionals and better electronic health record system interfaces is really, really key.
Excellent, thank you very much. Now, Ioana, we kind of had an agreement at the beginning that, or before this panel, that we would ask you to feed back at the end, but after the previous question, you had some things to say. So I don't want to deny you the chance to interject on a per slide basis. Did you want to say anything about this one?
Yes, I think it would be very interesting to remind basically that there is quite a lot of work done by several member states in order to ensure the trust in the data, a trusted governance for access to data. And the member states that have started to work on this, they came to quite similar conclusions with some variations, let's say, allowing, for instance, for a trusted institution which supports the data holders to get access to provide access to the data. They are basically joint controllers in GDPR terms with the data holders, hospital registries, etc. And they are allowing the access to the data under the strict secure conditions. This is basically the general model. There are, as I said, there are also variations with regard to the consent of the patient, so-called data altruism model, or broad consent of the patient, use certain categories of data, more electronic health records. Otherwise, basically, the whole construct in general is being built on a national law and allowing for a very strict control from the society and from the legislators, let's say. So I think this is something where we are looking very carefully in the context of health data space, because this allows a very solid data at the source and very trusted and controlled governance. We have also, we are working with the joint action in the context of the European health data space to see how we can develop options for the governance, taking into account these developments in the member states and also more decentralized systems. But again, I mean, the countries that have started and have gone through a very thorough reflection process, like Finland with the reflection process led by Sitra, like with Danny Port, like with all the work on the BFARM and the Research Center, etc., Denmark, etc., they have come to similar conclusions and to similar setups, which try to ensure the quality and the control and the trusted governance of the access to data. And this is something that we are looking very, very closely in the context of the European health data space.
Ioana, thank you very much. It's very good to know that these topics are really at the heart of where you're moving forward. Bledin, if we could move to the next slide. The next of the topics focuses on accelerating interoperability. I mean, it's interoperability and standards are not new, and I go back in my own career that when I left general practice, I got quite stuck into standards development, but sadly that's decades ago, not years ago. And yet still today, the on-the-street experience of the average patient is not of seamless flowing of information that gives them maximum benefit. And this slide is really proposing that we need to be much more engaged in how we think about standards in the future. We really need member states to be more proactive. It suggests here that actually we need to think about engaging the data creators and users, especially health professionals and patients, much more in the standards. So we have standards that really address their priorities and needs. Maybe we've got very techie standards, but we haven't got standards that live and breathe what they need. And of course, how do we turn these into procurable, demonstrated and transparently adopted standards? Nigel, let's turn to you first. What do you think we need to do to help really transform the living and breathing experience of standards adoption?
Wow, yeah, thank you. Thanks for that. So, I mean, yeah, you're right. I mean, well, one thing we don't need is more standards about standards. So that's one thing for sure. So that doesn't help. I think this is such a multi-layered issue. It is socio-technical, so there are technical aspects to this, clearly, in terms of interoperability and harmonization. I think within a European context, moving as we are seeing with projects like EDEN and other big data for better outcome projects in IMI, but also the European health data space, being federated, allowing actually, I think almost embracing the change. I think before we tried to push for a situation where everything was homogenous, and clearly that's just impossible. So actually embracing change, but allowing interoperability. So for instance, between national nodes within an EHDS, allowing for kind of member state derogation of healthcare, of course, but also differences in terms of the maturity of everyone's healthcare systems across Europe is vastly different. So I think embracing the change actually may sound a bit strange in this case of interoperability, but it is actually critically important. But working within it and allowing for socio-technical aspects, inclusive of not just technical, but also things like GDPR and ethics and consent and all the various principles which vary across in terms of implementation. I think we shouldn't let vendors and partners, providers and so forth off with this. I think electronic health record vendors have a massive role to play in this, and we're not doing enough to incorporate them, but also apply some gentle pressure maybe as well to ensure more greater harmonization. And the same goes for, I think, comments allied to what Jesper was saying earlier about individual or citizen generated data. There's not much in it in the moment for consumer tech to be truly interoperable either, because they're wanting to be too competitive and sell more watches or sell more devices, phones and so on. So actually a critical aspect of this is also quasi-political, I suppose, in terms of aligning agendas. And we had to do a lot more work on the socio and human aspects of this, actually even more so maybe than the digital and the data, to align agendas and ensure that we're all aiming at the same relatively similar direction within healthcare for this aspect. But so ultimately I would say embrace the change, apply pressure where you need, but ensure that we've got aligned agendas for the common good, and we currently need more work on that.
Thank you very much. Now, Nicola, apart from any other answers you want to give, I wonder if you could also include in your thoughts there's a bullet point on that slide that really suggests about a proactive, almost adjutant role of patients and citizens in pushing this. I'm not saying you have to respond to that bullet, but I would love it if you could find a few words on that bullet as well as any other comments.
So, I mean, I also identified this particular call for action as one of the most important things, because quite frankly, it will be pretty impossible to achieve this European health data space unless we're really serious about moving forward in very concrete terms about interoperability. And again, we've referenced COVID-19, but this current crisis points to how really critically important we start to get it right on this issue. We've had it on the agenda for very, very many years, as you've said, Deepak, but now is the time to move. And I feel there's a sort of crescendo of activities that are getting us to the right place, both on the project programmatic side, but also indeed on the policy side. So there's alignment of standards, there's measurement. This whole idea of verification is really, really important. But to your point on patients and citizens' engagement and their voice in this discourse on interoperability, again, really, really important. And I think in that context, Ilona mentioned the joint action on the European health data space, which of course is driven understandably by the member states, but there's no real opportunity for direct stakeholder involvement, patient involvement, citizens involvement in the joint action, which is a joint action also looking at the future governance of the European health data space. So maybe that's one very specific concrete takeaway that would help to actually promote meaningful patient and citizens engagement in shifting the agenda towards interoperability across Europe. Thank you.
Nicola, thanks very much. Jesper, I was very taken by some of the slides you presented at one of our roundtables, where you were absolutely seeing the future much more broadly than perhaps I had traditionally thought regulators would. So how do you see this topic of us really making interoperability happen for real?
A very good question. If I just knew, I would probably be a very rich man by now, which is not the case. So here we go. No, it's. I think let's think about all the other cases of interoperability we've had over the years, and everyone knows about Betamax and VHS tapes, etc. All of that happening, driving by consumers. At the end of the day, I mean, even this session is in English. It's not because, I mean, the invention of Esperanto did happen, yet none of us speak that, right? So it's really about where we all walk, what direction we take. It was mentioned earlier that some of the vendors out there don't really seem to be getting along with data standards. Actually, I start to see that slightly different as they move into some of the healthcare space. And we shouldn't necessarily name the names of the big ones, but they do seem to center around some of the HL7 standards now. As they can see that kind of fits in with their developers. It gives them a nice set of apps. It kind of drives the consumer platforms of accessing healthcare data. Really, again, democratizing healthcare data through that if I go to see the hospital, can actually access my own healthcare data. If that suddenly is there in technology, it drives the standards. So some of those megatrends is what is going to drive the standards. And it's actually legislation that then initiated all of that. And then we go to Obama's 21st Century Cures Act, the Meaningful Use Act, and all of that and what that has driven. And obviously, I'm now heading towards the concept around FHIR and the amalgamation of that. Well aware about OMOP plays a very important role in observational studies, and so does a number of other data standards within other fields. But there will be some big ones that will be the overarching ones, because consumers, all of us, will be using the apps, will be accessing the data that's accessible through those standards. That is where I see it's heading. That's where I think we should put our investment, making sure it's truly a standard, by the way, as we talk about that, and not only a commercial implementation. So.
Okay, thank you very much. I'm going to actually, in the interest of time, if you don't mind, Joanna, I'm going to move us on, because I'll let you have a last word a bit later, but move on to the next topic. So Bledin, if you don't mind, could we go to the next topic? And I'll just start summarizing it while the slide appears. So this is really about the benefits, that we can want everybody to collect better data, be personal users of data, but clearly we want to use data at a societal level to answer the bigger questions, whether it's research or public health. And what has been suggested on this slide is that the bodies that really give permission for the bigger scale uses of data need to be very transparent about what they're going to allow the data to be used for, what the benefits are, but then actually make public what has been the good of the data that they have permitted use of, and to engage the public in that process. Nicola, this feels like it's really aligned with some of the campaigning work that EPF have done, and also Data Saves Lives. Would you mind coming first on this topic?
Sure. Can you hear me okay?
Yes, yes.
Perfect, super. Yeah, I know this slide again resonates very well with the mission of Data Saves Lives, and also indeed some of the policy work that EPF has been driving forward over the last few years. It's all about transparency. It's articulating very clearly the benefits to society, but it's also about accountability, which is really critical. One thought I had in relation to this slide was actually the opportunity cost of not sharing data, of not focusing on responsible data sharing and what implications that would have in terms of moving forward. That's looking at it from a slightly different angle, but I think also useful just to really maybe focus very clearly on why this is such a critical area. I think, again, looking at the multi-stakeholder approach is really important here, and perhaps more emphasis could be made on industry and indeed public-private partnerships. Obviously, Nigel's mentioned AID and the European Health Data and Evidence Network, but such public-private partnerships there are also critical in terms of moving this agenda in a meaningful way. Also, another recent project on real-world evidence for decision-making is another really great example of unpacking what it really takes to move things along and ensure that we have buy-in across society. So those were my few reflections, and I'm going to take this opportunity to apologize, say goodbye to you. I need to go on another call, which I'm actually chairing. So my apologies for that, but I have to say I've really enjoyed the session, and thank you to my fellow panelists and to you, Deepak and Bledin, for your work in this area. Fantastic, and look forward to keeping in touch on the next steps. Thank you very much.
Lovely. Well, Nicola, thank you so much for being part of it and also for representing the voice of the patient and the citizen so eloquently and powerfully in our discussions. Thanks very much.
Thank
we
you.
won't forget that voice for the rest of the panel, but thank you for your time this morning.
Thank you, Deepak.
Jesper, regulatory perspective, but also your data analytics center. What do you feel about how we can be more transparent about the uses and the benefits of data?
Well, to me, it all goes with some of the success stories. I mean, how can my healthcare data provide benefit for the greater good? I actually think we've done a number of those cases in this country, in Denmark. Our Danish Health Data Authority is actually running a number of campaigns at the moment explaining how the healthcare data is being used for research, improving the healthcare system itself. I actually think that increases trust and transparency in how that data safely can be used. And I think that awareness, I think, is super important. Sometimes research becomes a little bit too convoluted and stays within its own circles, right? It is actually quite important for citizens to understand the value of the research that their healthcare data can generate. That actually helps. So awareness.
Okay, thank you very much. Nigel, you're building not only a super highway, but you're connecting a whole series of people who have data with people who want to use data. How does this slide speak to you as you know, one of the commanding officers of Eden?
Well, again, it's socio-technical. There are technical aspects to doing all of this, of course, and as you say, building the highway or the digital railway network or any analogy you want to use. But actually, again, it is actually hearts and minds that need to be won here, I think. And coming back to all the prior comments from Nicola and Jesper in particular, and relating to you know, it's the benefits as well. This last year, you know, are there aspects of dealing with this pandemic which were made easier actually by utilizing real world data? Well, yes. There are so many unanswered questions. We still have them now. So I think definitely providing benefits there. Again, it's aligning agendas. You know, why do people collaborate? For what purpose, and so forth. I think ultimately at the heart of all this needs to be some form of quid pro quo. There needs to be a balance, I think, in terms of, and a proper balance between those who have are custodians or have data in some form or whatever, host it or on behalf of others and so on, data about us and with us as citizens, and those, as you say, multiple stakeholders who are interested in utilizing that data for all sorts of what we should hope is transparent purposes. But there needs to be benefits on both sides. It needs to be balanced in terms of, you know, what do you gain from this relationship in terms of, you know, mutual insights from this data that enhance what you do as a data provider, if you want, or data partner maybe, and those who are using it for research. And the one thing we have to get away from, I think, is increasingly so, which is good, is the idea of walled gardens where you get to pick your own flowers. I think that's out. I think generally now we have to collaborate. And the key from all of this, we're working with real world data, is you have to collaborate. You know, I think the days of just having loads of data to yourself are hopefully receding, and that's a good thing.
Very good. Thanks very much. Just a quick note, Bledin, to you. I'm feeling when I look at the pace and the timing that we should regard this as the last of the topics, that we won't be able to take another big bite. If that's acceptable to you, I would like to now start shifting us slightly in the program as we discussed. Is that all right with you?
Yeah.
Okay, that's very good. So, Ioana, I'm actually going to turn to you now. We've had two topics one I didn't let you respond to around accelerating interoperability, and then this one really about how can we govern a very transparent way in which we ensure that big data resources are used for societal benefit, and that we tell society what have been the beneficial uses. It feels to me that the European health data space, and I know our roundtables and even other workshops that we've run through the DHE project, have said that the European health data space plays two roles here. You play what I would call a physical role, because you are building a real space that will be a portal into an expanding universe of data. But the second thing you do is you catalyze hearts and minds across Europe. So even for other networks and data spaces in other pockets of Europe, your efforts are helping us all to align, to discuss, to debate the topics and really expose what should be the best practices. How do you see these topics? If I could invite you to kind of give a broader reflection on the panel and the topics itself for a few minutes. Is that all right?
Yes, thank you, Deepak. I think
sorry, I realize I should just say to Bledin, do you want to launch the poll at the same time so that Ioana speaks while people are voting? Sorry, Ioana, I forgot that we let people do that.
So we put some messages in the chat box, so people have been voting already.
Okay, that's fine. That's fine. That's okay. We'll summarize the poll towards the end. So, Ioana, sorry, please go ahead and give us your thoughts on these topics.
Okay, so thank you very much. So on the interoperability, I think this is a fundamental topic that indeed is on the table for a very long time, and I'm not sure it will go away. We are working very closely with the eHealth network, as you all know. The Commission has put forward last year the recommendation on electronic health record exchange format on using certain standards, especially HL7 and IHE profiles like COMIT. So far, it's I think it's increasing. I think it's improving, and this is something that we should also think a little bit better in the context of the European health data space legislative proposal next year, how to strengthen the whole area of interoperability. Because what we have seen so far, it's guidelines, a lot of work of the eHealth network. Do we need to move, for instance, towards more legislative work in this area, towards more compulsory standardization? Do we need to look into basically strengthening, for instance, the interoperability, including between apps and mHealth devices and electronic health records? We've seen some member states, for instance, legislation which goes in this direction, like, for instance, German legislation on apps which are reimbursable and where the data from this information has to go into the electronic health records. Do we need to do this? Do we need to try to set up such, I don't know, interoperability bodies at national level that would cooperate at European level in order to come up with the accepted standards? And I would just like to remind, for instance, the discussion in the eHealth network steered by the Semantic subgroup, which has put forward a revised proposal for the patient summary, which says when people are moving abroad in the context of the exchange of patient summary and prescription through the eHealth DSI, they need to take with them, or they need to have access to certain categories of data which are in the patient summary, like, I don't know, vaccination, like medication, etc. And now they start recommended certain types of standards or formats, etc. And I think it's really the move towards the right approach and the right mindset in this direction. It was not easy. And there were a lot of hesitations whether to go in this direction or not. Is everybody using SNOMED or not? How to go? What to do? Can we support at European level, etc.? But I think it's something that we have to go, because otherwise it's a route that we have to go through, because otherwise we will still discuss in the interoperability, how necessary it is and how it is not being done. So I think we need to change a mindset, and I would really be interested to hear also from you and to have a feedback what we will need to be done in this direction. And this brings me about overall state of play. So next year we will propose a legislative proposal on European health data space, which will be structured on 3 main pillars. The first main pillar is related to data, prime data, so the use of data for healthcare, and the secondary use of data, the use of data for research, policy making, and regulatory purposes. We see in the member states that the interlocutors are sometimes different. One case is, for instance, e-health agency. In other cases, bodies dealing with the secondary use of health data. So we are really looking at these governance models at national, at European level very closely, and also how to make a meaningful collaboration between those two. The second pillar is related to the digital health services and removing barriers to the digital health services. We already have some elements in the Directive 2011-24, but clearly there are new areas which have to be taken forward. In the Directive, we only cover the telemedicine, and we need to go beyond. We have telehealth, we have mHealth, we have a whole set of new digital health services with different legislation in different member states, with quite a lot of barriers to be basically shared between different member states and provided. And we would be very interesting to hear from you. We will soon be publishing the Inception Impact Assessment and a consultation. So it's really important to have the right input into the into the legislative proposal. And the third pillar is related to health services, especially with AI. Here we are working very closely with the colleagues in DG Grow and DG Just, because this is a whole new area of work, and it's very important that we ensure that we get things right. We are also working at the same time on infrastructures, not only for the primary use of data, exchange of patient summary, prescription, and enlarging to new areas like images, lab results, and discharge letters. And we hope that by 2025, we will have patients from all the member states benefiting from this possibility of exchanging their healthcare providers. We are also working, we start now working together with the EMA and the CDC and different member states on an infrastructure for secondary use of health data, use of data for research and policy making. Again, we are working on this with the joint action on European health data space, and clearly bringing on board in EHDS infrastructure initiatives like IMI, like EDEN, like research infrastructure is absolutely essential, and we try to see how best to do that.
Good.
And
any final thoughts there, Ioana?
Sorry,
I just wondered if you had any final thoughts. We're a little bit tight for time now, so I just needed to ask if you had any summing up.
So basically, my final plea is just to repeat the one I've made. We really look forward to your feedback and input, because this is absolutely essential for the next steps. Thank you.
Very good. No, thank you very much. And I think it's partially delightful to hear about the number of initiatives that you're involved in and ways you're consulting. But I think another important message is how much you're listening. That's something that's really delightful to know, that you want to hear from stakeholders, you want to do the right thing and serve the value to everyone, and that you're in listening mode, learning mode, hearing what people will like, so that you can deliver the best solution for Europe. And I think that attitude is a very, very important one for us to hear and respect and be grateful for. So I'd like to turn to Bledin. Would you be able to tell us what the audience poll has told us?
Thank you. Yes. So if we can please, the tech team, if we can display the results of the first poll question. Okay. So the question was, who should create a list of data uses that would normally be supported and those that would not be supported? And the clear winner is a selection of multi-stakeholders drawing all of the individual organizations named above. So a clear winner from the audience.
Good. Why don't you present all the questions, sorry, the poll results, Bledden, and then I'll give the panelists half a minute each to give a quick reaction.
Okay, poll question 2, please. So which call is most important to you? And as we might expect, there'll be different results, but again, the clear winner is the much broader transformational approach to health data. Poll 3, please. So if health data reuse is to be a societal good, who should define the benefits and value of such? And again, like poll question 1, the selection from multi-stakeholders is a clear winner. So please, the last poll question that we asked. So to develop trust in data use and access, which would you prefer to see? So written laws, series of separate compacts, a combination of A and B, and a combination of A and B is again the clear winner. So over to you, Deepak, and the panel for some
Right. So, well, let me just ask Nigel and then Jesper, do the results of the poll surprise you?
I could keep this really short and say no. And just because of time, I'll keep it short and say no. I think that's completely unsurprising, actually. That probably fits with most people's kind of fairly egalitarian view to responding to these questions. Jesper.
Very good. Jesper, you can have a few extra seconds then.
Yeah, I'll do it brief as well, though. But what I see here is there's a broad understanding about that the solutions we need are across different disciplines, and it really is a consensus that needs to be achieved in order to go where we need to go, and positively inspired by the transformational approach. And I think if we consider what has happened over the past half, almost to a full year now, on the COVID-19, how many transformations we've actually seen. I think there are a number of them. I think there's this joke on the internet who actually did digital transformation in your company, your CEO, your CIO, or actually COVID-19. And it's actually COVID-19 who has driven digital transformation. So, and transformational approach, maybe that is kind of the shock start we need to really do something completely new. So.
That's great. Thanks very much. I think that one of the slight drawbacks of the poll, the way we've run it, Bledden, is that the people who voted for a transformational approach to health data didn't ever see what that slide said. So that's too bad. I'm not going to ask you to show it now. But it really is speaking to the fact that we need to think about health data very differently, rather than saying who owns it, whose data, who's got it. Yes, we have to respect the rights of the individual, the person who is the data subject, whose data it is. But once we have their support for the uses of the data, then the clear message is we need to treat it as a societal good, not about who next has ownership and possession and exploits it. This is something really that everybody should be able to benefit from, and that all stakeholders need to be in together, helping to ensure what are the rules that protect everyone's interests, how do we make sure benefit is accrued, and how do we share back to individuals and to society how we are making good use of data, and that those we asked to be the custodians of data repositories and the people who look after the data on behalf of society have done the right thing and have actually made sure that the best good has come for the benefit of all. And I think that is a very powerful message that is beyond any individual initiative. It's really saying society is calling now more strongly than ever before for us to make use of data, but in ways that benefit everyone, not benefit individual companies, individual organizations. Really a wonderful message, I think. And I think you and I, Bledin, we need to look after that as we move forward, which takes me back to you and to ask you then, where do we go from here?
So some closing remarks. So I think what we have tried to do very quickly in presenting some of our draft calls to action is to road test some ideas and to allow us the opportunity to refine our ideas and our thinking. And as you can see, we've given Deepak and my email addresses, and we would be very grateful for anybody who has any suggestions or thoughts or things that we haven't covered. And I know in the chat box, I saw two comments, one about the fact that we may have talked about patients a lot, whereas actually we were also talking about citizens and persons. And that plays into particular some of the points made by Jasper about consumers and consumer data. There was also an interesting comment about child data. And if that person emails us, we'll pick that up, because we want to see the DHS and IHD look at implementing some of these calls to action to the extent that they're not involved with particular organizations. And before I say thank you, there's one other thing. So for those of you who are sharp-eyed, there is a sort of virtual prize for anybody who quickly and first tells us which room Nigel Hughes is actually sitting in for this presentation. Sharp-eyed TV followers, that's the hint. But with that, I'd just like to bring this panel to a conclusion and to thank the panelists for their time and for their contributions at the roundtable, which we're very grateful for. And I hope everybody's learned something and found something of interest today. So thank you all very much.
Thank you very much. And Bledin, I'd like to also convey my thanks then to Ioana, who has been a kind of quasi-panelist, but also taking away many of our learnings.